This conference will now be recorded.
Hello, everybody. We're really happy to be with you here today. We are in the middle of some pretty historic times in the history of our city and the history of our country. The COVID-19 outbreak is something that is forefront in all of our minds today. And so I'm really thrilled to have with us today two of the high-level leadership people in the Westminster Fire Department to speak to you today about their response to this issue and some of the things that they're doing. And I've got a few questions for them. I'm going to let them introduce themselves. We've got the head of EMS and one of the deputy chiefs. And Jeromy, if you might not go ahead and introduce yourself and maybe tell people a little bit about your background.
So my name is Jeromy Hill. I'm the EMS chief for Westminster Fire Department. I've been with the fire department just about 17 years now. My background is primarily in EMS. I began as a firefighter and was a paramedic for several years. Then became an EMS field coordinator, and now am filling this role here as the EMS chief. So I basically guide and manage the entire EMS division of the Westminster Fire Department.
Thanks, Jeromy. Thanks for being here.
Hello, my name is Erik Birk. I'm the Deputy Chief of Operations for the Fire Department. I've worked for the City of Westminster for 18 years. I served as a paramedic for 17 of those 18 years. I served the role as a company officer, fire captain, battalion chief. I've also held the role as emergency medical services chief and have been overseeing operations for the last year. Anything related to 911 services, medical, fire, hazardous materials, any other response, I oversee those operations for the city.
Thank you. And thanks both of you for being here. You're the perfect people. Person who just ran EMS for quite a while, and now the person who's running it. And you know, I guess I'll just say, because we have people who see Westminster Fire Department and probably know this, but I'll say it, is that you know, Westminster Fire Department really is fire and emergency medical services. So when you've got a medical emergency, not just a fire, and you dial 911, it's the folks that come from those 6 stations in our city. Some of which are firefighters, some which are trained paramedics to deliver service to you, and they're really at the front lines of dealing with people who are ill. So you can see why these folks are so important to the conversation today, because if somebody's sick at home, you know, with a virus, and they call 911, it's the staff that work for these gentlemen that'll show up at the scene and be the first responders. Well, I'd like to start with just talking about COVID-19. And whoever would like to take this question, just what has COVID-19 meant to the Westminster Fire Department, and how has it changed the way you're doing things in response to emergencies?
Don, I'll take that question. You know, the Westminster Fire Department is always preparing for emergencies. You know, planning and preparedness is part of our essential operations. In relation specifically to COVID-19, we have changed some of our operations as a result. There are no changes to our 911 or emergency operations. We continue to respond to 911 calls and emergency medical and emergency fire incidents just like we always have. The only thing that we have added is some specific procedures that are designed to help keep our personnel and the community as safe as possible. In our non-emergency areas of the department, we have made some changes. You know, right now our fire administrative office is currently closed to the public. However, we do have some staff, limited staff working at that facility. We have staff working remotely, and we still can address non-emergency needs from the community and questions from the community. We have our main business line and main email, which can be found on our website. We have staff monitoring those. So if you have questions or have non-emergency needs, feel free to reach out to the fire department and those at those number or emails so that we can address those needs. Additionally, we've changed some internal practices just to be in alignment with national, state, and local health department recommendations regarding social distancing and doing our part to try and limit the spread of the virus. So we're starting to conduct a lot more of our meetings like this one via video conferences. Also, our trainings have been now focused more at the station level rather than our large company training operations. In addition, our fire stations are currently closed to the public, and we're not doing ride-along processes. and we're not doing in-person public education. We're continuing to see how we can meet the needs of the community in those areas. And these are temporary measures that we have implemented just during this period of time. And again, the 911 emergency operations are, there is no change to our ability to provide those services. And if you need those services, you can call 911, we'll respond. And we still have individuals dedicated to the non-emergency needs of the community, and we can address those questions through our line and email.
Again, for either one of you, have things changed at all, though? I would suspect they will when it comes to screening your response to emergency calls, because you just don't know what you're walking into, right? And very importantly, gentlemen, you know, maintaining the health of our emergency responders and all of our health professionals is at the forefront of society today. So what is it that you're doing to screen to understand what the response needs to look like in a particular call?
We've worked closely with Westminster Police and Fire Dispatch, and our dispatchers are asking additional screening questions. Those questions can pertain to travel and other symptoms that may be indicative of COVID-19. Now, those questions are really important for our emergency responders because it helps us, one, identify what care we may need to provide on scene, and also ensure that we have the required personal protective equipment. Now, these questions are not just being asked on medical calls. We're actually trying to, when feasible, ask those on all 911 calls. You know, whether it's a fire alarm or maybe an auto accident, we're trying to really determine if any of these symptoms are there and to help ensure that our providers are protected. And in addition to those questions and screening tools used by our dispatch center, we are, as emergency responders, are asking additional screening questions when we get on scene. So when we get on scene, our employees may stand back a little bit further than normal, ask a couple questions about, you know, any symptoms, any family members that may be displaying symptoms. Again, just measures to make sure that our personnel in our community are safe.
I think that's a good overview and explanation of how things are a little bit different today. Is there anything else that people should know about when they call 911 and an ambulance responds, what they can expect to have happen, and how you want to maybe leave people's concerns by what they're going to see transpire after they make that call?
Sure, that's a great question. As Chief Birk alluded to, we have had some changes in our procedures as far as screening goes. If we do identify patients who meet those screening criteria, we may be donning some additional personal protective equipment such as gloves, gown, masks, eye protection such as just regular safety glasses or goggles. We don't want these people who see us in that type of equipment to be alarmed. This is just a normal precaution for us. It's there in order to keep us safe as well as to keep them safe. When we do get on scene, they may be asked those questions, as Chief Birk alluded to, on the 911 call, but we may ask additional questions, and it may seem awkward because somebody could call us for, say, a sprained ankle, but we may still ask those questions of, have you experienced any fever or coughing or trouble breathing, something like that, or has anybody in your household experienced those symptoms? Just because we do want to be conscientious of everything around us to make sure that if there is any risk of exposure, we're making sure to protect the community members as well as ourselves as best as possible. Just one thing to allude to in regard to if a patient is exhibiting those types of symptoms, like I said, fever, coughing, respiratory distress of a mild nature, at times some of the best treatment is going to be management of that person at home. Currently, there is no specific treatment for COVID-19. There are some testing procedures in place, but there's nothing that they can do to cure the illness per se. So sometimes we may recommend to patients to just stay home if their symptoms are mild. It's going to be more comfortable for that person to stay home. They're likely not going to get any specific treatment at an emergency room, and that would just ensue an additional bill potentially as well for them. So we want to make sure that we're acting in the best interest of the community and the citizens that call upon us to make sure that we're providing them with the best care. We don't want them to think that we are not taking their complaints seriously, but we are pretty well trained as far as these symptoms and what is life-threatening and what is not. So that's something that, we want to make sure of. And we also want to ensure that these local emergency rooms aren't becoming overcrowded with these types of patients, because we want to make sure there's room for patients who are experiencing those life-threatening illnesses.
Yeah, that's really well said, Jeromy. I've been involved in some conversations here nationally about this issue. And as I was mentioning to you before we started the actual interview, one of the grave concerns in this country is that we'll overtax our healthcare system, our hospitals, our emergency rooms, our doctors, our nurses, our emergency management professionals. And so I know in your case, it's a fine line. If somebody is ill and needs your help, you want them to call, and you want them to call you and feel comfortable doing that. At the same time, I think I'm going to say something here, and if you disagree with it, please jump in. But we have a network in this country of how healthcare happens. We have individual personal physicians, or we're parts of network where we have access to medical information. And I think all of our doctors are available 24/7, or somebody on call to answer questions. People are scared right now, though, because they see people moving very quickly from sniffles and coughs, respiratory issues, to serious illness. And so they want to know how to deal with it. And I just think there's one thing I would say is that for everybody is to read a lot about this and what's being said, and listen to the things you've said here about what to be careful of. If you can't breathe, I would suspect you're going to say, call 911 and have us come out. But it may be coming on, and it may be something you want to talk to your physician about. So I appreciate you doing that. And I think part of what we're here today is to make sure that people use those networks in the appropriate way, so none of them break down. And I really appreciate that. In regard to COVID-19, I'm going to be real specific. In regard to COVID-19, when should people call 911?
I think you just touched on it very well. If you are suffering from severe shortness of breath or difficulty breathing to the point where you're experiencing dizziness, lightheadedness, things like that, and it's sustained for a long period of time, and you feel that your life may be in danger, that's when you call 911. If you have an underlying illness that may make you more vulnerable to these types of illnesses, such as COVID-19 or respiratory problems in general, that's something to be concerned about if you think that you may be developing this illness. If you have mild symptoms like a low-grade fever, just an occasional cough that's not, causing you to have severe respiratory distress, maybe some mild intermittent shortness of breath, which is, typical for any types of flu or respiratory illnesses, I'd recommend either staying home, and if those symptoms persist, calling your primary health provider, or even just reaching out to a telehealth, maybe Ask a Nurse type phone number, and just having them advise you if those symptoms are severe enough for you to need to call 911. Again, a lot of times the best care that you can have is going to be just staying at home and being as comfortable as possible. These symptoms in most cases are not becoming life-threatening, except for in the elderly population or patients who have other underlying conditions. So, a lot of us will stay home with basic cold or flu symptoms and manage on our own, and we know those. So if you're feeling something like that, where you're not uncomfortable and not fearing that, this is more distressful than normal, I would say try to manage at home, and your first call should be to your own personal care physician or a telehealth Ask a Nurse type resource.
That's terrific. So I want to tell you just publicly in front of folks here how much we thank you for your service and the work that you've done in selecting this career for 17 and 18 years. And I'm really pleased to work with all of you. And you represent a lot of really great professionals that do this work. And so I want to ask you, because I think people wonder about this, what can people do to help you? What can people in the community do to help our Westminster Fire Department, EMS, our healthcare system today? What would be a bit of advice you'd leave with people?
Don, I'm glad that you asked. I think following the recommendations of local, state, and national health, public health agencies, such as the Colorado Department of Public Health and Environment, the Centers for Disease Control, and following those recommendations to stay home. Don't go out. Try to limit the amount of exposure you have to the public. And if you do have to go out, keep that distance between you and the others around you, because really this illness is exchanged in a close radius of proximity. You know, the kind of magic halo is about 6 feet around somebody. So if you do have to go out and about, stay at least 6 feet away from people as best you can. And while you are staying home, follow those routine cleaning, disinfection protocols like frequent hand washing, making sure you're wiping down high touch surfaces like handles of refrigerators, stoves, dishwashers, sink handles, things like that frequently, cleaning hard surfaces as much as you possibly can, and making sure that if you are sick, you're staying away from others as best you can as well. Also, we're pretty grateful that we've received some recent donations from residents and businesses in the city of Westminster who have reached out and said, we know from the media stories that have been aired that there's a shortage of personal protective equipment, and some of these very generous people in our community have said, hey, I've got 25 surgical masks, will you take them? It's been wonderful. We do take those. We are unable to get a steady flow of personal protective equipment right now. So when we get those offers of donations, we do take them and we do distribute them throughout our public safety personnel in the city. And it's been wonderful to see the community really rise up and reach out in the way they have. And we appreciate that, and we'll continue to take any donations like that if people have them to provide.
Terrific. I think we're getting close to wrapping up now. I know, Erik, you've got some materials that we're gonna attach to this blog. People can download. You want to talk about that a second?
Yes, I know that there's a lot of questions related to COVID-19, you know, symptoms, how we can protect ourselves, where do we get more information? You know, Jeromy touched on that being in contact with your primary care health provider is key if you have symptoms. You know, there's individuals that may not have access to a primary health provider. And we're going to give you a link to the Colorado Department of Health, Colorado Department of Public Health and Environment website. And there it has information related to COVID-19, information related to testing. It also has lines for tele-nurse and helplines where people can call and get their questions answered related to COVID-19 and can help get that medical advice that they might be seeking. Additionally, we're going to give a link to the Center for Disease Control's website, and that has some more information that would help the public, you know, as we try and learn more about this virus and what we can do to limit the spread.
Does that cover it for both of you? Jeromy, Erik, any last words?
I just would again like to reiterate Jeromy stated earlier, and I'd like to thank the community for all the support that they provided us. Those donations are extremely helpful and greatly appreciated, so we thank you very much.
We sure appreciate your leadership in Westminster Fire Department. We appreciate the relationship with local IAFF 2889 and the folks that are in the front lines. And that's your history, having come up through an organization where you were at one point in your career there. And I appreciate you being in these leadership roles. And we appreciate our Chief Doug Hall a lot. So appreciate what you've said today. Hopefully people will spread this word. And if you've listened to this video and you learned something from it, please let your friends and neighbors know this is available. And I think it'd be a good investment of 20 minutes time for people to understand how to deal with this issue themselves. We really need your support and your help to push this down, to flatten that curve. So thank you.
Thanks for having us.
Absolutely.
Thank you.